Hi there. I have looked at your teaching plans for week 7 and have thoroughly enjoyed watching you craft such unique ways to approach service learning. It is really cool when we think about the concept of service learning. Basically, we're making our community the classroom. We're taking a concept from the curriculum that's related to our students' academic development, and we're allowing them to practice skills, ideas, concepts, behaviors in a community setting in a meaningful way that serves the community. So many of you had such creative ideas, really awesome presentation methods. It's one of those times as an educator, especially online, when I feel like I'm alone in a bubble all by myself, that I really wish that I was in a classroom and I could say, okay, everybody, your assignment is to make this happen. You guys would do a fabulous job of being really polished nurse educators, but more importantly, being the hands and feet of Christ in your community. So many wonderful ideas. Some of the ideas were that there was a teaching plan related to the care of cancer patients that involved doing a spa day that really addressed the health needs of patients who were dealing with cancer, but also pampering and nurturing them at the same time. There was a community event to do screenings for blood pressures for the elderly in the community. There was also an activity that dealt with homelessness and the Salvation Army and looking at community awareness. There was, I think we had another care of the elderly. There was one that dealt with teen pregnancy and educational material that would be made available to them in the community setting. There was a general introduction to service learning, which I think is a fabulous way to approach the concept. Service learning is a really difficult topic because basically you're creating two teaching to learner sets. You're taking your classroom or your hospital-based setting students and dragging them into the community. Maybe not dragging. Hopefully they'd go willing. And then they teach or provide some kind of education to learners in the community. So to understand the twofold aspect of service learning, I think it's great to provide an introduction to the topic in a meaningful way, and then associate an activity with that. There was one that dealt with veterans and volunteer services to help them navigate the system, which I thought was great. There was one that dealt with socializing the elderly using Skype. So going into the community and having students apply what they know about the social needs of the elderly and allowing them to connect in meaningful relationships using technology. And part of the teaching plan was to actually teach the elderly how to use Skype, which I thought was brilliant. I'm 44 and Skype still gets me sometimes. So I think it's such a cool idea that we're gonna, take millennials or sort of millennials and take them out and work with the elderly. I thought that was brilliant. And then another dealing with the elderly in a health fair setting and having them go through activity centers and walk away with a tangible worksheet of all their health factors. So lots and lots of cool ideas. I always get tickled that the elderly always get the best shake in this assignment. I would love to see somebody do little people. There's so many cool things we can do with kids, and even just going out to a playground and doing something about helmet safety or something. So maybe when you become formal teachers and you're in a teaching setting, when you do a service learning project with your students, do something for the little kids. Okay, fabulous time. I've thoroughly enjoyed the past 4 or 5 hours looking at your work. So fabulous. Okay. Next week is kind of that where the rubber hits the road. You're going to use either your general teaching plan or your service learning teaching plan and create a 10 to 15 minute video of you providing the education component, or actually implementing your teaching plan. I've had several of you kind of struggle with, okay, my original plan was to do a 2-hour lecture, but Dr. Hutchins, you're only giving me at max 15 minutes. Why? The truth is, we know from lots and lots of data, lots and lots of research, that people stop listening after about 15 to 20 minutes. We know that students learn best in micro lectures, that if we give them snippets of information, we maintain their attention for about 15 or 20 minutes, and then we do an activity, we do some sort of intervention, we do something active from an active learning standpoint to engage the students in the concepts that were just covered. They retain information better. So I want you practicing those micro lectures. And in a perfect world, we're going to work away from the sage on the stage approach of, the professor standing in front of the class and pontificating for 3 hours of lecture and everyone furiously typing or handwriting. We know that that does not create meaningful long-term retention of knowledge. Micro lectures do. So having you be disciplined about this is important. So if you were one of those that came up with a 2-hour lecture that was fabulous, but I'm robbing you of an hour and 45 minutes, look at your teaching plan. Figure out the piece of it that you are the most comfortable with, the most excited about, and demonstrate that teaching plan in your video. If your teaching plans were in the classroom, then the expectation is that you will be in a classroom doing your teaching plan. If you were doing distance learning, or you were doing an online module, or you were using a flipped classroom module, however you wrote in your teaching plan, if you did a virtual or a distance teaching plan, then you would do a voiceover PowerPoint. Either way, the important thing is be congruent, and then be time aware. 15 minutes is 15 minutes. I promise you, if you go over that, it is going to be a beast to load the information and create a URL or a web link from YouTube, and it will be very hard to get it to load. And after 15 minutes, I'm going to start taking points. So stay focused, be scripted. I will tell you, I've been teaching for about 8 years now, and I don't go into any lecture without a time plan. I know how many slides are in my slide set. I know where I'm going to take a break. I know at what time that break should occur. Do that with this plan. Go back in and kind of think about what this looks like and create a timeline so that you can break this apart and not make yourself crazy trying to video something and then realizing it's too long or it's not long enough or you've not covered the content in the way you want to. Be intentional. Also be authentically you. If you're socially awkward and a little uncomfortable in front of the camera, that's okay. You should have seen me for the first few years I was teaching. I was a hot mess every time I met a new group of students. If you're gregarious and charming and you have a great sense of humor and you use your hands a lot when you talk, be authentic. I want to see who you are in your teaching environment. So I hope that provides you enough guidance. I think I have hit all of my love notes for you. If you have questions or concerns, remember that we have the Ask the Professor link. Use that as much as possible because there's lots of questions that cross over. So I want to make sure that we're being efficient in answering each other's questions and providing guidance. So use the Ask the Professor link if it's specific to you. Then please touch base. Have a fabulous week. Remember, everything's got to be in by the end of the day, Friday. Yes, Friday. I think which week we were in. Know that I'm here. Know that I'm praying for you. It has been my joy to have you in class. And as a final note, please do the course evaluations. My hope is that when you think about the role of a nurse educator, that you value formative and summative feedback. You as a student, I know, value that. Educators should value that as well. And one of the ways we get that 360 feedback is through our students. My hope is if you've been grinding your teeth, waiting for this class to be over because you feel like it's been a horrible experience, please do the evaluation and be honest. But please also contact me directly and let's talk through any concerns you may have had. That's how professionals handle, when our needs aren't being met or there's a concern. Either way, I want your feedback. So please take the time to do the course evaluations. Let me know how you are and let me know if you need anything. Take care.